Hello, my name is Dina Wright, and the other members of my group are Alexandra Boyer and Alexandra Brabeck. We will be presenting West Nile virus. I will begin by explaining the etiology and later on talking about treatment and protection. West Nile virus is most commonly a mosquito-borne virus, usually found in tropical and temperate regions, but has spread into North America and parts of Canada. Most people get infected by being bit by an infected mosquito. West Nile virus belongs to a viral family called Flaviviridae, and the genus is Flavovirus. It is a positive sense, single-stranded RNA virus that has an enveloped capsid, icosahedral in shape, and is approximately 50 nanometers in diameter. Once released into a cell, the RNA replicates itself and, carried by the bloodstream, is moved to the lymph and central nervous systems. West Nile virus is known to be an arbovirus, which means it is transmitted by insects, and in most cases, mosquitoes. The element that makes West Nile virus hard to battle is its ability to cross the blood-brain barrier. The immune response that leads to the breakdown of the blood-brain barrier is then when the virus enters into the central nervous system and causes encephalitis, which is inflammation of the brain, or meningitis, which is inflammation of the lining of the brain and spinal cord. West Nile virus was first isolated from an adult woman in the West Nile district of Uganda in 1937. It first appeared in North America in 1999 in New York City. According to the Centers of Disease Control, as of October 11, 2016, a total of 46 states and the District of Columbia have reported West Nile virus infections in people, birds, or mosquitoes in 2016. Overall, 1,264 cases of West Nile virus disease in people have been reported to the CDC. Of these, a little more than half were classified as neuroinvasive diseases such as meningitis and encephalitis. A little less than half were classified as non-neuroinvasive disease.
Hey guys, my name is Alexandra Boyer, and I'm here to talk to you today about the West Nile virus host reservoir, as well as how West Nile virus is transmitted. West Nile virus is spread quite easily since mosquitoes feed on a variety of animals, but the most common host reservoir for West Nile are birds. Birds are a good host since they can carry the disease without showing signs or symptoms of it. They are also a good host because they carry high levels of viremia in their blood, which means they can carry a lot of viruses in their blood. Humans cannot, so we are considered dead-end hosts.
Hi guys, my name is Alexandra Brabeck and I'll be doing the presentation on the signs and symptoms of the West Nile virus. Signs and symptoms of the West Nile virus. A sign of the West Nile virus is a skin rash like the one shown below, and symptoms, most people, 70 to 80% who become infected with the West Nile virus do not develop any symptoms. About 1 in 5 people who are infected will develop a fever with other symptoms such as headache, body ache and joint pains, vomiting and diarrhea, and a rash. And most people with this type of West Nile virus disease recover completely, but fatigue and weakness can last for weeks or months. And then there's severe symptoms of the West Nile virus, and less than 1% of people who are infected will develop a serious neurologic illness such as encephalitis or meningitis, which is inflammation of the brain or surrounding tissues. And these symptoms are headache and high fever, neck stiffness, disorientation, coma, tremors, and seizures. Serious illness can occur in people of any age, but people over the age of 60 years are at the greatest risk for severe disease, and people with certain medical conditions such as cancer, diabetes, hypertension, kidney disease, and people who have received organ transplants are also at a greater risk for serious illness. Recovery from severe disease may take several weeks or months. Some of the neurologic effects may be permanent, and about 10% of people who develop neurologic infections
Many different
due
kinds
to
of
West Nile
mosquitoes can
virus
carry this
die.
disease, but the most common mosquito is C. tarsali. The process of transmitting the disease begins as soon as the mosquito starts probing the host for blood. Saliva of a mosquito makes the West Nile virus thrive. When it was transmitted by a mosquito, it was shown that higher levels of the virus are in the host's blood than if it were transmitted with a syringe. Humans and horses are accidental hosts of this virus. Accidental because we cannot continue to carry the virus on to other organisms. A cure for horses has been found, but not humans.
There is no current vaccine or cure for West Nile virus. Over-the-counter pain relievers can be used to reduce fever and relieve some symptoms. In extreme cases, some patients might need hospitalization with IV fluids, pain medication, and nursing care. Patients with encephalitis would require close monitoring for seizures, respiratory failure, and elevated intracranial pressure. Since there is no vaccine or cure for West Nile virus, the best form of control would be prevention and protection. Always stay informed of any outbreaks in your area by contacting the Centers for Disease Control at www.cdc.gov. Mosquito-proofing your home would be one of the most important aspects of protection. By limiting the areas where mosquitoes can breed in standing water, in things such as clogged gutters, neglected pools, bird baths, old tires, toys, uncovered boats, open trash cans, leaky hoses, and rotted trees. Installing nets and screens on all doors and windows, using air conditioning, and using fluorescent lighting, which does not attract mosquitoes. Avoiding outdoor activities during dusk, dawn, and in the early evenings, which are peak mosquito biting times. When you do have to go outdoors, wear long sleeve shirts and long pants, while using mosquito netting whenever possible would help prevent bites as well. Lastly, applying insect repellent that contains DEET. Recent evidence shows that mosquitoes intensely dislike the smell of this chemical. The Centers for Disease Control and Prevention recommend 30 to 50% DEET to prevent the spread of pathogens carried by insects.